For this treatment session on dementia, our patient's name is Jason. Jason is a 66-year-old male with dementia. He has suffered from early onset dementia from the age of 55. His family has recently reluctantly moved him to St. Catherine's. He is currently under the 24-hour supervision dementia unit. His wife Shay has recently purchased an apartment on St. Catherine's grounds and would like for Jason to live with her for as long as possible. Our goals for Jason are to decrease his rate of decline, provide a safe environment for him to live, and maintain as much of his independence as possible.
Hey Jason, I'm Alex. I'm going to be your occupational therapist. So we want to work on some strengthening activities for the first part of your program. I'm seeing you for dementia, so I think that doing some strengthening activities is going to help with your cognitive functioning and also is going to make you stronger for being able to complete your ADLs and staying independent as long as possible. So that's our main goal. So I'm going to demonstrate a few activities, and then I'm going to get you to try them, and then I'm going to give you a home exercise program. And I want you to try to do this, like try to use the weights and the bands for like an hour a week, like twice a week. So we'll start with that and we'll see how you do, okay? Okay, so the first one that we're gonna do is a bicep curl. So you're just gonna have your arms, and you can do this sitting at your chair, feet flat on the ground, arms down like this, and we're just gonna curl up and then slowly release down. And we can start by doing about, we can just do one set for now to see how the weight feels. And I would say about 3 sets of 10 would be good. So you can go ahead and try these. This is just 4 pounds. I'm gonna grab something else.
Feels pretty good.
Okay. So I'm gonna demonstrate this one. Okay, so these are just some ankle weights, and I'm sitting on our ankles. These are 4 pounds too. And just make sure you're very careful when you put these on. And also I wanted to say, make sure you have someone with you when you're doing these exercises just for safety. So with these, you can just hold on to the back of a chair and just kind of bring your knees up and do some marching.
How many of those do I do?
We can start with 3 sets of 10, so you can just go ahead and try 10 right now if you want, just to see how it goes. And like I said, this is just one part of your program, and then we hope that by adding this in, you'll be more independent with ADLs and just kind of like things around the house. And we're gonna do a home evaluation and go kind of look at like check your safety and make sure there's no like rugs on the floor, things like that. So this is just one component.
Like this?
Yep. So just try 10 of those.
6, 7, 8, 9, 10.
Okay.
Okay, Jason, now we're gonna work on some like home modification things to try to make your home like as functional for you as possible and as easy for you to manage and stay independent as possible. So the first thing that we're gonna work on is kind of removing clutter. You can see in your hallway you just have some things like scattered about. So we're gonna wanna make sure to keep these things in like a closet or out of the way to reduce like trips and fall hazards or getting confused about where we are or anything like that. I'm gonna kind of shut those off in closets. Then we're gonna continue in here, and I see you have some little rugs in your bathroom. These can be a big trip hazard. So we're gonna wanna make sure, this one's good. This one has a no slip thing, so this one can be good. That one checks out. We wanna make sure our rugs are not gonna be a slip or a fall hazard. So this one might wanna be rolled up and kind of tucked out of the way for now. Okay. Okay. The next thing we did is I kind of made you like a morning routine schedule that you can follow easily. And so I just got the basic things here: brushing your teeth, combing your hair, using deodorant, and getting dressed in the morning. And also I have labeled where these things will be. So this is where your toothbrush is kept. Makes it easy to find things, so you know where your deodorant is in here and your brush is in this drawer, just to make your morning routine a little bit easier to follow. Okay. So I've added these carpets along your wall so that in the morning when you get up and you get ready to go into the bedroom, you can come right out of the bedroom, feel along the wall, and find your way straight into the bathroom. So that'll be easy to make sure you kind of like a texture pathway to make sure that you can find where you need to go in the morning. Okay, and then I also added some things in the bedroom. Added some more labels. Added a shirt to your shirt drawer. And we've also kind of limited the things that are in your shirt drawer. We're gonna just put only a few items of clothing in each drawer to kind of limit your options, and so where it's not so overwhelming every morning when you're trying to pick out what you want to wear. Okay.
Okay, so Ms. Shea, we've kind of gone through the apartment with you and your husband and shown you the labels that we put on the dresser and in the bathroom, and his morning schedule. And also, if he's having trouble with the drawers, you can lay out some clothes for him in the morning.
Yeah, so just so he'll kind of know what to put on. Okay.
Yeah, so that just kind of takes away a step for him. And then, since he's wandering, we also suggest possibly a full-time caregiver for him, just to have that extra security, and maybe installing a security system. So if he does slip out, then you'll be notified.
Yeah, that's good.
In order for him to continue living with you, we do suggest making these changes, and we'll help as much as we can. And then later down the road, we can reassess and see where he is and see what we need to do. Do you have any questions?
No, I think that sounds good. I'm going to need some help, so I think full-time care would be a good idea.
Okay.
All right,
Great.
thank you.
Yeah.